chemicals? Read aloud. Okay, manganese and carbon disulfide, etc. What is extra? So there are many more things are there, but these two causes more Parkinsonism symptoms. How it is causing? So that can diffuse the damage to the brain exhibiting Parkinsonian symptoms. Understood? Here, so where you have learned these types of infections due to toxin. In community medicine, you might have learned due to occupational hazards. In occupational hazards, you might have learned these types of things. Yes or no? Yes or no? Toxicity things. Yes or no? So due to that thing, occupational hazards, people will go for Parkinsonism. Okay? Now, various drugs also cause Parkinsonism and multiple system degeneration. This is the most important thing. Multiple system degeneration. Okay? Normally we see in degeneration in ortho conditions. Yes or no? Osteoarthritis. What is the osteoarthritis condition? Degeneration of articulating bones. When going for the degeneration in spinal bones, what is it? Disc degeneration. Degeneration of the what disc? IVD, intervertebral disc. So these are ortho conditions. Okay? But what are the degenerations that occurs in this neuro area? Like conditions like Alzheimer's. In last class we have studied what we studied? Dementia. Yes or no? What is the main role of dementia here? If the people is going for dementia, they will be losing all the ability to do the exercise. Yes or no? Their ADL activities. And all these conditions will develop what? Rigidity. Okay? Alzheimer's, Shy-Drager syndrome, supranuclear optomalegia, Wilson's disease. So these are all diseases which causes the what? Parkinson's. Clear? Now, next one is metabolic. Okay, what is metabolic? Abnormal calcium metabolism can cause the disposition of calcium in the basal ganglia, causing Parkinson's. Abnormal calcium metabolism. Normally in human beings, we need to have a certain level of calcium. How much level of calcium a person needs? Approximately, a person needs about 30 to 100. What is it? 30 to 100. 30 to 100 is the normal ratio for the calcium level in the human being. If the persons of age 50 to 65 going for level of 9 calcium in the blood, what will happen? This Parkinsonism will induce the factors. Okay? Normally going for the calcium and all. Nowadays, even a 20-year-old boy is having level of 9 calcium. The normal level of calcium is 30 to 100. Clear? But the 20-year-old boy is having level of 9. Whether Parkinson will affect this 20-year-old boy? Yes or no? No. Why? Because we also studied that the Parkinson is mostly affecting the age of 50 to 65. Okay? So we need to build up the calcium for this 20-year-old boy to avoid certain ortho conditions. Understood? If the patients of 60 to 65 having less amount of calcium, we need to give some supplements. Calcium supplements. What and all? Sunlight, egg, milk, all these things will increase the calcium level of the patients. Okay? Now, going for the traumatic. What is traumatic? Already we have studied this traumatic. What is it? Head injury. While learning head injury itself, we studied different pathophysiology. Yes or no? Two types of pathophysiology we studied. One is primary, one is secondary. So this primary is going for